Good morning. Welcome back to the Broadcast Retirement Network. This is BRN AM for Wednesday, February 28th, 2024. And our top story today, housing is linked to lower cancer mortality in U.S. veterans. Joining me now to discuss this and a lot more, Dr. Hannah Decker is with the University of California at San Francisco. Dr. Decker, it's great to see you. Thanks so much for joining us in the program this morning.
Oh, thanks for having me.
Yeah, this is, and as I was explaining to you before we started the interview, this is a really important topic for the Broadcast Retirement Network, and I know you feel equally passionate in terms of your work. How pervasive is veteran homelessness, and how impactful is it to overall health?
That's a great question. Thank you so much. So we know that the federal government has made ending and addressing veteran homelessness a priority since 2009. And what we really have seen over the past decade plus since that time is a marked reduction in veteran homelessness overall. There's actually been a 45% reduction in veteran homelessness, which far outpaces the changes in the general US population, where the unhoused population has actually been increasing, especially in certain parts of the country. And so we have seen that veteran homelessness, while a big issue, is something that the government has been tackling in part through the VA. And then in terms of how homelessness affects health, there's a wealth of studies that have shown that being unhoused affects nearly every single aspect of health. Unhoused people have higher rates of chronic diseases like heart disease and cancer, which are two of the leading causes of death in older unhoused adults. They have higher rates of traumatic injuries, have higher rates of substance use disorders, and all of this culminates in markedly premature rates of mortality for unhoused people compared to the general population. So when we talk about how housing impacts health, it really impacts every single element of people's lives and their health outcomes, and we can see that in premature mortality.
And let's talk about this study, because your study and the team study, I know it takes more than a village. It takes a village to do this type of work, but since I have you front and center, the study that you led and helped author, it's unique. This is unique. It's the first time that this has ever really been done, correct? To tie some of these chronic conditions to housing.
That's right. Yeah. So the study that we did was really trying to answer the following question. Does gaining housing in the year after cancer diagnosis, is that associated with better outcomes than remaining homeless? And there have been studies in other realms that have looked at the health impacts of gaining housing, but it hasn't been studied before in cancer. And we thought that it was important to study it in cancer because a few reasons. One, cancer is a leading cause of death, like I said, in older unhoused adults. Two, the unhoused population in this country is aging. So at this time, nearly half of all of the unhoused single adults are actually aged 50 years or older. And that's the age at which cancer incidence increases. And also screening recommendations start to kick in, where we start to recommend screening for certain cancers. And so we really wanted to see, the last thing is that we know that cancer treatment is very complicated in today's day and age. It's multidisciplinary. It takes inputs from medical oncologists, surgical oncologists, radiation oncologists, social workers, and all different people who touch many different parts of the healthcare system. And so we wondered, does gaining housing help facilitate some of that care and help contribute to better outcomes overall?
Go ahead. I interrupted you and right in its thought. Go ahead.
That's okay. So to try to kind of answer that question, what we did is we looked at about a decade of cancer diagnoses at the VA. And what we were able to do is ascertain people's housing status. So were they unhoused at the time of diagnosis, or were they housed at the time of diagnosis? And then in the year afterwards, did that housing status change? Did people gain housing, or did people lose housing? What we found, we had a sample of over 100,000 veterans, so a very large sample. We found is that just about 5% of veterans were actually unhoused at the time of cancer diagnosis. And of that group, 20% actually gained housing and were housed in the year following diagnosis. And when we compared outcomes between those groups, What we found, which I think is not surprising, is that the unhoused veterans had worse survival overall after diagnosis with lung and colorectal cancer specifically. But the veterans who gained housing in the year afterwards, they actually had really improved survival. That was, in fact, about equal to veterans who were housed for the entire period of time. So we found that to be pretty interesting and pretty exciting, actually.
Yeah, I mean, it just makes a case that if you are housed and you get the appropriate treatment and you get screened, because screening is an important part of catching cancer early so that you can treat it, you've got a higher survivability. When you just define housing, how do you define that? Is it a shelter? So if you maybe you don't have your own house, but maybe you're rooming with someone, or you're part of go to a local shelter. How is that housing defined?
That's a great question. And I think that it actually really highlights one super important issue with research and programs related to housing, which is that we know housing exists on a spectrum, that there's high quality housing and then there's low quality housing. And then that goes on and on and on to living in a shelter, living in a tent on the street, being unsheltered. And so it's very hard to actually determine where along that spectrum people fall. And one of the reasons is because in large administrative data sets, like, through hospital systems or other kind of health systems, really, we don't do a very good job of documenting housing status. And we definitely don't do it with the level of granularity that I think you're alluding to that we really need to know. But the VA, in contrast to that, really does a great job of documenting housing status, which sort of goes hand in hand with this federal effort to address and end veteran homelessness. Because to do that, you have to be able to identify it. So through the VA electronic health record, there are multiple places where housing status is documented. And we were able to cobble together all of those different sources, from diagnosis codes to housing registries and all of that, to say, well, who really is unhoused and who is housed? And the way we were able to tell how that changed over time was because the VA periodically screens veterans and asks them, do you have stable housing? And so a lot of it is actually self-reported and what a veteran considers to be stable housing. But for the most part, living, in a vehicle that's not really suitable for or wasn't designed to be, a living situation, living in a tent, living outside, living in a shelter, all of those we would consider to be unhoused based on the federal government's definition of being unhoused.
Well, Dr. Decker, I need to take a very quick break. When we come back, we'll talk more about veteran homelessness and what policymakers should be thinking about when they look at this study. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Dr. Decker, thanks so much for staying with us. Really appreciate you hanging around for segment number 2 this morning.
Oh, thanks for having me.
Yeah, it's a very, very important topic. So this is a groundbreaking study because you're tying these chronic diseases, cancer, to homelessness and whether or not what the mortality looks like. How does this inform the VA? How does this inform our policymakers who fund the VA and also help the VA kind of navigate its initiatives? What does it mean to them?
Thanks for the question. I think what we're trying to highlight in this study is something that my mentor, Dr. Margot Kuchel, who's a senior author on the study, says, which is that there's no medicine as powerful as housing. And we really wanted to highlight the association between gaining housing and better outcomes overall. And we think, this is a retrospective study, so we can't say for sure that gaining housing caused better outcomes, but we can say that those two things are associated, and we have some hypotheses for why that may be the case. We think that housing leads to an ability to make it to outpatient appointments. It reduces competing priorities. It reduces exposure to outside forces that you might be vulnerable to when you're living on the street or you're living in a shelter. And so I think that the VA has already done an amazing job at adopting housing first principles, but and of course there's more to be done in terms of getting unhoused veterans housing. I think what's really interesting is how the lessons from the VA can actually be adapted in other settings as well, because we know that the VA has a different sort of set of strengths and resources and constraints that exist in other settings. One interesting thing is that the findings that we saw in the VA, we did see worse survival outcomes after cancer diagnosis in unhoused veterans when compared to housed. But those were actually much smaller than we observed in other settings, like in public hospital settings or other studies that have been done. And so our next, thought is really about how we can take some of the lessons from the VA and adapt those to other settings.
Yeah. Again, I guess it goes back and forth. I mean, the VA, my understanding is the VA is the largest healthcare provider in the world. So they have they do a great job for such a volume of cases that they treat, people that they treat. So it's absolutely amazing. Doctor, how do you follow up on this work? Because it's groundbreaking. You looked into housing. I would imagine that there are a lot of things going on in your heads and the team's heads about how do you collect data? How do you further mine this hypothesis to confirm it? Where do you go from here?
Thanks for that great question. I think that what we're really interested is learning about how the VA, getting a more deep understanding of how the VA gets veterans into housing, especially those that are diagnosed with serious chronic diseases like cancer, and what works for these patients and for these people, and how can, like I was saying, how can we adapt that to other settings? And I think that that's really important, especially in the context of this new focus on the upstream social determinants of health. We know that health outcomes are, sure, they're related to the medications you get and the treatments you get, but a large proportion of your health outcomes are actually related to things that happen outside the hospital walls and outside the clinic walls. And there's a new emphasis on this. And there actually has been a move for insurers, including Medi-Cal, which is the Medicaid for California, to focus on upstream social determinants of health, including housing. So we think that it is important to really try to understand the things that the VA is doing right in these cases and think about how can we adapt these to other settings, and how can we continue to build the body of evidence that housing is associated with better health outcomes in order to continue to motivate increased investment in the social determinants of health that are upstream of a patient ever walking into my clinic.
Yeah, proactive versus reactive treatment. I mean, that's where medicine is headed. And again, credit all to the VA because they're the largest healthcare provider in the world. They're doing a lot of great things. And I wonder, doctors, just to kind of close it out, do we need to do a better job of education? We always can do more education. So understanding, when I've not served in the military, but I have family members who have, And when you serve in the military, there's kind of there's regimented behaviors, going to the doctor, getting looked at. And then maybe when you transition to civilian life after the military, maybe there needs to be some lessons about education about, okay, these are the things now that you need to think about. Going to get your regular checkup, doing the screenings that you were mentioning in segment 1. Do we need to focus some of our attention and not to say that people are ignorant, they're not ignorant, but just making sure that when you leave the service, you transition into civilian life, that you're learning all these important things that you have to do, get your ears checked, et cetera.
That's a great point, and something I hadn't thought about. I mean, but I'm always in support of more primary and preventative care and education for patients, because we know that, prevention is really the best medicine.
Yeah. Dr. Decker, it's great to see you. Thanks so much for joining us. Great study, and we look forward to having you back on the program again very soon.
Thanks so much.
And that wraps up this episode of BRNAM. Have a topic of interest? Someone you think we should talk to? Drop us a line, and don't forget, for all the latest curated news on lifestyle, wellness, finance, tech, so much more in all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, visit our website. We're back again tomorrow with another edition of BRNAM. We'll have a very special guest and another important topic. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.